Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection, another very important subject. This is David Parra with AARP, and we have a very important subject today. We name it health, more than healthcare. I think health and healthcare is a very popular subject. For years and years, I believe that forever, in the history of this nation, I believe Medicare was part of the Social Security Act of 1935. It took 30 years before the United States Congress and the president, then it was LBJ, they signed Medicare into law. So, and healthcare has been a subject that never goes away. And so today we are going to continue that tradition, so to speak, and talk about health. But we're going to talk about health from a different perspective. And I myself have been involved in educating on healthcare, particularly since the Affordable Care Act in 2010. That brought in another layer of discussion and of involvement, if you will, on healthcare. And now we see with the current administration, some things being undone, so to speak. So I think you are stay with us. Invite your friends. This is a very, very important subject. Again, the subject is health more than healthcare. Let me introduce our guest today, and then we're going to jump into the subject because there's a lot to cover. To my left, and I'm just going to kind of go from left to right, is Monica Villalobos. Now, you got your PhD or you're still getting it?
I graduate in May 2019.
Okay, so I cannot call you doctor yet.
Not
okay,
yet. No,
remember
Gonzalo jumped the gun a little bit.
Okay. But still, welcome. Let me see. You are the vice president of the Arizona Hispanic Chamber of Commerce. Am I correct on that?
Yes, I've served as vice president for the last 7 years.
Perfect. Thank you for joining us. I know you just got in town this, morning?
Yes.
Yeah. Thank you. And now we also have John Ford. You have a pretty nice name, Ford, like the company. Like the car?
Indeed.
Yeah.
It depends on the era, whether I'm associated with the car, the director, or the president.
Good. And you are the director of strategic initiatives for Vitalist Health Foundation. And I believe Vitalist used to be St. Luke's Initiatives, correct?
That is correct.
John, thank you very much for joining us.
Thank you for having us.
All right. And then to my right is Annabelle Castro Thompson. I love saying your last name because you mix the two, the English and the Spanish. Annabelle Castro Thompson. ¿Qué te parece?
Perfecto.
Thank you, Annabelle, for joining us today. And well, first of all, thank you so much for joining us.
My pleasure.
Yeah. And, let me say just a little something. I went to the Datos presentation in this year, of course. And I don't know, Monica, if anybody else wrote to you or said anything to you, reached out to you about this amazing, you call it the wheel, John? You said to call it the wheel? The wheel, I call it like a chart. And it's called the element, what comprises a healthy community? Elements of a healthy community, and it lists 12. Am I correct, John? 12 elements of a healthy community. So it literally brings in the issue of health from a I shouldn't say totally, but more holistic approach. Monica, did anybody else make comments about this amazing thing that you did or whoever did it in bringing this concept and linking it to Datos in 2018?
Absolutely. We received a lot of positive feedback. And the reason is that we've been producing Datos for 22 years. There's a lot of data that goes into it. Last year's book was 500 pages. And when people receive that, it can be a little overwhelming, particularly if you're not accustomed to looking at data day in and day out. What we really wanted to do was make it more friendly. I often say we wanted to move it from the reference section in the bookstore to the self-help section. vision. And this framework helped us do that. We'd been working with Vitalis, with John and his team for over 2 years to understand this model a bit more and how our data might fit into it. And it took us that long to really understand it, to absorb it, to look at the data differently. And with this new framework, it allowed us to make the data more actionable. And that's the feedback that we've been receiving.
Perfect. Let me ask the first question, because to me this is an amazing concept. I mean, when I had to leave early that day, and as soon as I got this, I said, I can leave now. I mean, this is an amazing blueprint.
Thank you, I think.
Oh, I am telling you, it lists 12 elements of what constitutes a healthy community. And and you are linking it to health. Because again, health, many times, the first thing that comes to our mind is healthcare, insurance, right? I have good coverage. But you are bringing it from a different perspective. So let me throw in the first question. First of all, who came up with this concept of the social determinants of health, the elements of a healthy community? How far back does it go? Is this a new concept? What is it?
So here's the backstory. The World Health Organization actually came up with this term, social determinants of health, quite some time ago. And so it is all very research-based, evidence-based as to what influences your health besides just healthcare. The situation in our country is that we're always going to default. As soon as I say the word health, you're going to say healthcare. Right. And then I tell you to not think about that anymore, and you say, you know what, I should exercise more, I should lose weight. This is the sort of predominant frame. We all think health is healthcare and personal responsibility. What we're ignoring is everything else around us that's shaping our health. And that's what social determinants is saying, look, all these other things have an influence on your health outcome. The problem with social determinants of health is it's an academic term. And so for the general public, it's a little bit inaccessible. For those of us who do know what it is, we are more than happy to debate with each other about which determinant is more important than the other, and so on and so forth. And so in 2016, Vitalis sat down with a whole bunch of community partners and said, let's just try to figure out something else, some other way to look at this. And so we did. We just took the social determinants apart. We talked about what matters in Arizona and what doesn't. And then we said, you know what, let's give them all equal weight, which is why this wheel concept came up. Was like, so health is in the center, and all these other things have an influence on that health. And let's not figure out whether healthcare is more important than transportation or housing is more important than education or anything like that. Let's just give them all equal weight, with the exception, by the way, there are 12 things on the outside of the wheel. There are 2 rings on the inside of the wheel. And the reason those are there is because they are cross-cutting. That's equity and that's resiliency. The community's ability to bounce back, but also the community's ability to treat everyone equitably. Not equally, but equitably.
I want to come back to Annabelle, but just let me ask you one more question. Tell me, I mean, in very basic terms, why is it important to see healthcare within this bigger scope? Very in a brief way.
In the briefest,
what does it affect?
The briefest way we can say it is this. We have been entirely focused on and invested in healthcare, which is why our country spends $3.3 trillion annually on healthcare. Right. We're not getting the health outcomes that we should.
Okay, I'm getting it.
And so in order to get the health outcomes that we should, we have to be thinking about these other elements.
Perfect. It's crucial, I assume.
Absolutely.
Now, you are a nurse practitioner. Oh, sorry. You have many titles, but let me summarize. You are a nurse by profession, correct?
Yes, a nurse practitioner.
Okay, I got it right.
Provider.
Yeah.
Yes.
But now you moved to a different industry, a different type of work. So what is it that captured you to move into that, Annabelle? And then just feel free to share about these concepts as well.
David. So for years, David, I've worked in medicine, right? I have 15 years as a nurse practitioner, and I've always noticed some of my colleagues say, well, I tell all my diabetics to do the same thing, right? You need to exercise and you need to eat healthy. It's just that some of my patients are non-compliant, okay? And non-compliance, David, is a term that we throw out in medicine. Non-compliance means that you're giving somebody a direct prescription to do something, right? Or a direct suggestion to do something. And the patient is not willing. What we know now in medicine is not that the patient is not willing to institute that change, is that they're virtually incapable. And I'll just give you a small example. Yeah. So if I tell all my patients to exercise and eat healthy, somebody that lives in a low-income community perhaps finds that their community, I can't afford a gym membership, and my community is unsafe for me to walk because perhaps there's violence, there's no sidewalks, or there's stray dogs.
So we're
right?
putting a lot of blame on the patient, a lot of responsibility when there are other
Yes.
factors that play into this.
Yes, and those are the social determinants of health. David?
Right.
Now,
And those community members are simply making the choices that they can choose from. You know, I often ask people to imagine the scenario. You know, you just got out of work, you just picked up your kid at daycare, your kids are tired, you're tired. It's 2 miles from the daycare center to your house, and on the way, and there's no food in the refrigerator. And on the way, you've got convenience stores, fast food outlets, liquor stores, and gas stations.
Wow.
What's for dinner tonight? I mean, hopefully not liquor,
Right.
But probably fast food, right?
Right.
So, and that's the choice any one of us would have made,
Right.
And that's that's just the structure of that community.
So in essence, you are trying to basically bring holistic perspectives. You know, the reason why we are not producing the health results that we would like is not that we have rebel people or that they don't listen, but there are other factors that play into this. We have to go on our first break. Stay with us. Sometimes people say that the zip code you live in will determine how soon you will die and how healthy you are. Let's see if we can elaborate that concept, which I believe has a lot of truth to it. Stay with us. You are listening to AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. I don't know. I always say this, but I am so happy. I have an amazing job. I get to have these shows, and I get to have this knowledgeable people, and I'm the first one to benefit from it. I'm not kidding you. Thank you again for being with us and for addressing these heavy-duty issues. You know, I mean, these are heavy-duty issues, and even that makes me feel good that I'm involved in addressing such important issues. Again, the topic today is health more than healthcare. Now, can we elaborate this concept? I've heard it several times about that the zip code will determine how healthy you will be, and even how many years you will live. I'm sure you're convinced about that. So shoot away. Help us to understand this concept a little bit deeper.
You know, it's well documented, and it's a simple thing actually to do from a statistical standpoint. All you have to do is look at mortality data, and then what you see is two zip codes that are within 10 minutes of each other. Mm-hmm. One has a life expectancy of 71, and that other one, 85.
71, that's what?
14 years difference. 14 years difference in maybe a 10, 15-minute drive. What's driving that? All these elements of a healthy community. Mm-hmm. It can range from air quality, housing stock quality, educational opportunity, economic opportunity, social justice. All these things are playing major factors in those outcomes. And that's the thing that makes it most stark is when you look at a zip code map like that. I actually just saw some recent data for the Valley. There is one zip code in the Valley where the life expectancy is 90 years of age. Wow. And then you've got this other zip code in central South Phoenix that is 71 years
Let's
of age.
talk about central South Phoenix, because I was part of, with the Hispanic Leadership Institute, we were involved with an issue that called food deserts. And you were there. Mm-hmm. And so if you happen to live in an area where the transportation is lacking, there's not a lot of good, healthy food stores. And then on top of that, you have all kinds of factories. And then on top of that, you don't have sidewalks to walk and not accessible parks. That's not a good place to be in, Annabelle.
No, it's not. And that's exactly to the point that John is getting in. We notice that these deficiencies are more prominent in low-income communities, perhaps, or where minority ethnic communities live. And then if we look at more affluent areas, perhaps one that are more populated by white Caucasian populations, we tend to see this disparity. But this disparity is very evident not only in the United States, but also outside of it. And I'll just give you an example. In Sierra Leone, the life expectancy is 34 years of age. In Japan, it's 81.9 years of age. And there's no biological differences in the cell, right, in the human being to explain those differences. The same thing happens here in the United States. This is a Latino program, David. White Caucasians in our country live approximately 78 years. Latinos, life expectancy is 69. Right. And so it's 9 years less than other populations. And this goes back to the root of the problem, what we were talking about, the social determinants of health. The social, environmental, and economic factors affect people in more ways, but particularly in health.
So we're trying to get people healthy. We get the doctors, the drugs. But are you saying that there are other factors causing people to get sick? And so we're just trying to remedy something, but not touching the source of the problem.
Right. So we have to work our way back to the root cause. And I think this, by the way, is a lot where the partnership between Datos and Vitalis came in. Was Datos is very much about helping people understand the untapped human potential of the Hispanic population. And that's exactly what we're talking about here related to health. This is untapped human potential or suppressed human potential. Right? That zip code that we talked about in South Central Phoenix, that's exactly where all the redlining happened. That's exactly where people of color were forced to live in the 30s, 20s and 30s. Okay. And it has suffered from disinvestment. It has suffered from policies. It has suffered from industrial coming into that area. All these things are not entirely by accident. Maybe they weren't entirely intended, although many probably were, but it's not by accident. Right. And so if we're going to make a change, if we're actually going to be serious about improving life expectancy, if we're actually going to be serious about equity, if we're actually going to be serious about tapping untapped potential in Arizona, this is where we need to do the work. And we need to do it using the elements.
Right. And Monica, I asked you off the air that by linking the elements of a healthy community to Datos, where you basically deal as the Arizona Chamber of Commerce, Hispanic Chamber of Commerce, with businesses. And I ask you, why do they need to know? How do they play a part into all this?
Sure. The Arizona Hispanic Chamber of Commerce has an investment relationship with over 70 corporate partners in Arizona. We estimate there are about 90 Fortune 2000 companies here in Arizona. We have access and we provide data to those companies on the Hispanic community because we want them to have reliable, responsible, and relevant data. So, for instance, one very good example about health and the impact of food and affordable food is that 20% of U.S. Hispanics are food insecure. So that means they don't have access to those good foods that we were talking about to have better health, to be able to treat their diabetes in the way that they eat. So what we're able to do is have a very candid conversation with our food retailer partners and say, we don't just need you to be at the festival. That's very helpful, and we appreciate the investment in the community. We need you to build more locations in those food desert areas that provide healthy foods. That's very different than, oh, wow, Hispanics over-index on quick-serve restaurants. Right? Right. That's a different action indicated there. And that's why this data is so important to our corporate partners. It gives them some real actionable things that they can do in the community that are profitable, but more importantly, provide for overall health.
So without knowing it, they may be contributing to a problem in the process of, making a living through their business if they're not aware of these elements of a healthy community?
I'd like to phrase it as they have a really great opportunity to contribute to the solution.
Got it. Perfect. Now, and again, I have to believe that because there's the element of money involved, that it's not an easy thing. Now, if I remember right, Annabelle, you work with insurance companies. What are you trying to tell them and so that they buy into this concept? I think this is a very important question because I have to believe that the insurance companies are going to be a key component of all this. So what are you telling them? How are you getting them on board, quote unquote?
I think, David, that healthcare is changing, right? Mm-hmm. The tide is changing. There's deep transformation happening in our healthcare system precisely of the reason of why what we're talking about here right now. We spend so much in the United States per capita for healthcare, and yet we don't have great outcomes in care, right?
That is unbelievable, isn't it?
Yes. Such as what John was talking, right? The statistics that he gave. And so everyone is looking at ways, if we are beginning to understand that social determinants of health are important, I will tell you that the reason that all the 6 major payers or health insurances here in Maricopa County, why they're working with Equality Health is because we found a way to operationalize and how do you communicate with the social determinants of health, the community agencies. I like to call them the community-based organizations that are doing such great work in the community. We actually now have a way to interact with them, to document the encounter, and then we're going to be making better solutions or better responses, right, as to how much is that interaction worth, right? What is that telling us? How do we need to incentivize them so that they become more part of the healthcare system, which everyone is trying to
So you're trying to incentivize them to invest a little bit more on this other area, and in the end, they will also benefit, not financially. Because if it's not financially feasible, they probably are not going to buy into the idea. So is that kind of like how you incentivize them by saying, if you invest into these other areas, in the end, you will also make more money, so to speak.
So you're talking about the community-based organizations?
The insurance companies.
The insurance companies get it, David. The insurance companies understand that what they're lacking is the infrastructure, the communication. Up until now, technology was a barrier to the extent that we're asking the healthcare system, which has a lot of HIPAA laws, privacy laws, right, that protect our personal information.
Right.
We want to share that information with the community agencies that are able to help some of these patients, but many times we can't share that information. So how do you forge those partnerships so that they have the information? But it's not that the insurances don't get it, it's that up until now, how do we operationalize that was a challenge for the community. And I can go on about the challenges and the barriers that existed. We think, however, that Equality Health is cracking that nut.
Okay.
And we're actually
Are you pioneering this work? Because I have never seen another company trying to do this thing. Actually, sometimes I even have a hard time understanding exactly what you're doing.
And there's so much, right, in the business lines that we do at Equality Health that people trying to wrap their mind. But the important thing about Equality Health is that we're actually forming an alignment in the communication structure so that behavioral health entities, medical entities, and community-based organizations actually have the same information. They're functioning under the same platform, so everyone has visibility into the holistic aspects of a member.
I'll come back to you. I have another important question. John, so who should know about these things? Who is the target of this message? Are politicians, insurance companies, business partners, community organizations, the people, the community?
Everybody.
I mean, this is basically a more of a I suppose that the hope is to produce a transformational or have a transformational effect on healthcare, how it's offered.
The original intent of the wheel, one of its main goals, was to shift that paradigm that we talked about earlier. Health does not equal healthcare plus personal responsibility. Health equals healthcare, personal responsibility, education, transportation, housing, social justice, air quality, parks and rec. I mean, it's all the elements. It equals all of those things. That is something. So David Foster Wallace is this writer who gave the famous graduation speech about there's 2 fish swimming in the water, and the third fish comes up on the 2 fish and says, "Hey boys, isn't the water great today?" And he swims on. The first fish looks at the second fish and goes, "Water? What water?" We have to recognize the water we're swimming in, all of us. The community does, electeds do, insurance companies do, providers do. Everybody has an influence on our health.
No,
you're not just a street and traffic engineer. You're a health person.
Yeah. We'll have to go on our second break. But let me just real quick. Is Vitalis holding conversations, real brief, and with who?
The answer is yes, and with anybody who will come to the table to talk about it. Cities, towns, insurance companies,
I
health
assume
providers.
You also have to go and knock on doors. I'm not sure that they're going to willingly just come to you.
Nope,
so you're knocking on doors?
We're going to them, yeah.
Perfect. Stay with us. We are addressing health more than healthcare. This is AARP, Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. Health more than healthcare is the subject today. And I have to come back to this amazing chart. And the good thing about this amazing chart is that it's online. I just downloaded a couple of days ago. If you go to, I believe it's Vitalis. Is that the website?
It is available at vitalishealth.org, yes.
Vitalishealth.org.
Is there an electronic version of the...
There is.
Okay.
And is that on somewhere on the website, Monica?
Yes, at azhcc.com.
And is that the one you actually offered?
That is correct.
The ones that has the data on for the Hispanic community.
That's correct.
Great. Again, if you would like to get this online version of this wheel or chart that I call it, it has 12. And actually, let me just read them to you. I think it's worthwhile. Elements of a healthy community. 1, access to healthcare and coverage, affordable quality housing, community safety, economic opportunity, educational opportunity, environmental quality, quality affordable food, healthy community design, parks and recreational opportunities, social and cultural cohesion, social justice, and transportation options. It is amazing. I mean, this is, if you ever wanted to build a community somewhere, a new community, this is the blueprint, right, John? This is the blueprint to have a community, and not only have a community, but to have a healthy community. So let's come back to Annabelle. Annabelle, I know that by you talking to people and organizations and insurance companies, I'm sure you're learning a lot. Tell us a little bit more about how that experience is going for Equality Health. And then if you can elaborate a little bit more, just to maybe examples of how these determinants of health are affecting our health.
Sure. So David, at Equality Health, I'm Senior Vice President of Equity, Diversity, and Inclusion. Mm-hmm. What that means is that we are taking an approach to healthcare delivery through a cultural-based model. And the reason for that is because we know that culture, at least for Latinos, it molds the way I interpret my environment, and culture also guides behavior, right? Mm-hmm. In addition to that, we have a second component that we concentrate on. Your support system is very important because the support system, specifically in Latinos who are high on familismo, are going to impact my access and my decision-making. Mm. And then last but not least, the third component that we focus on is what we're talking on here, is that health is much more than an intervention at the time of illness, right? The social determinants of health are important. So where I live, where I was born, where I grow, where I worship, where I'm going to age is going to impact my health. And so those are the three things that we look at Equality Health. We are learning a lot of information. One of the first things we did at Equality Health is we're changing the way that we look at social determinants of health to the extent, David, that we created our own proprietary tool that assesses for social determinants of health. The things
this is
that we were
similar to an app,
here.
For example, a program that people can...
Yes, we have an app. So this tool, we have an instrument actually that
online instrument.
We have it online. We have it in mobile app. We also give it to our providers. We have 1,500 providers that are part of Equality Health. And every one of them is told, when you see one of my patients come into your office, you put this tool in front of them because it's going to allow me to know whether they have any problems with social determinants of health. Do they need transportation? Do they have housing insecurity?
This is like a survey kind of thing?
It's a survey, yes. And we do it in that way, David, because the provider already has the trust of the patient, right? If the provider puts it in front of you, we have 98% completion. So patients are telling us every day at every encounter whether they need utilities assistance, whether they have housing problems, whether they have food insecurity, whether, right? It's through this tool that we learn these things.
Learning about these things that the community is going through, what does that tell you as Equality Health, and what does that tell the insurance company?
So it tells me, David, that if I want people to achieve health, it's not just enough for them to go to their provider.
And the providers will eventually get that information from you.
So the provider uploads, we have a very sophisticated technology platform. Every day they upload all these surveys from their patients and send them back to us. And then we score that tool. Based on the score, it's intervention-based, but I have care coordinators at Equality Health that will pick up the phone and say, Ms. Castro, if it was me, I noticed that you just filled a SUCRA or a health access survey. I noticed that you have X, Y, and Z. Let me help you and let me connect you with community-based organizations that can help you. Why, David? Because what we're finding is that if people don't have the basic living necessities, if I don't have enough food for everyday things, dental care, medical care, prescriptions become a luxury to me, right? Because as a mom and as a person, I am going to be more interested in feeding my children, making sure that they have the basic necessities, that we have a roof over our head, before I engage in preventable care or prescriptions or anything of that sort. So we're revolutionizing healthcare delivery in that way. And then we're doing a lot on the back end to ascertain that when I send a referral to a community-based organization, that it doesn't get lost. Well, did Annabelle make it to the food pantry? Did they make it to X, right? We're making sure that we have those accountable partnerships with them so that the information is getting back.
I think you painted a very good picture, and thank you for that. As you said, they're pioneering this work, and I'm sure this will continue to, to evolve. Coming back to you, John, what sort of action needs to be taken to embrace these concepts and act upon them?
You know, it really starts again with that realization, and to build off of what Annabelle was sharing. Look, Annabelle can write all the prescriptions she wants for blood pressure medicine, and it's going to lower my blood pressure at least temporarily. But if the cause of my high blood pressure is because daily I'm trying to figure out whether I'm going to pay my utility bills, feed my kids, or actually end up homeless, I'm still going to have high blood pressure no matter what that medicine does.
Okay.
Right? It's that realization.
Level,
right.
The stress level due to these other elements are not being addressed.
Right. So this can sound judgmental. It's not intended to be, but in any low income neighborhood that you walk into, Annabelle can go walk into that community. I can't because I'm not a doctor or a nurse, but she can. She can draw blood. She's going to find high levels of cortisol in almost every member of that community. High levels of cortisol are the precursors to everything you do not want: overweight, diabetes, cancer, stroke, heart disease. The whole thing, right? And what's causing this chronic stress, what's causing these high cortisol levels is chronic stress of the kind that I just described.
Right.
We all have to gain an understanding of that. Like this is the basic math of the equation. If we want to improve health, if we want to truly give people a chance to tap into their untapped potential, if we want to actually build healthier communities all throughout Arizona, we have to understand that basic equation. All of us do. And then we have to contribute to the solution. Because Equality Health cannot do it alone. Vitalist cannot do it alone. The Hispanic Chamber cannot do it alone.
Right.
AARP cannot do it alone.
Right.
We all have to figure out, A, what our roles are in solving that equation, and then B, we have to jump out of our boxes and work together on solving it.
What would you say is Vitalist's biggest success, be it at a lower, basic level or even at a bigger picture level that you've accomplished in making entities aware of these amazing concepts?
Wow. I don't know if I can point to one thing. I would say that what has been really gratifying is to see the wheel come back to us, and people didn't even know it was ours. They're like, here, look at this. This is what, and we're like, yeah, we know. We got it. So to see the wheel appear sort of all over the place, all over the country, and have people really truly reflect and understand of what the wheel means. To have, I mean, a great success is sitting right here in the room, having it be embraced by the Arizona Hispanic Chamber, and having them become a partner in the process. All those things in terms of change and understanding have been critically important to the long-term success in here in Arizona.
Is it fair to say that this social determinants of health is going to affect primarily the lower income communities?
I think it's where the most impact can happen the most rapidly. It is still true, though, that, I mean, high-income community, it's funny, actually. Annabelle referred to Femalissimo, right? The great ties that are in the Hispanic community, they don't exist in upper-income white communities.
Right.
There is no social fabric.
Right.
So there are different profiles for different communities.
Got it.
You know, David, it used to be that from a CMS perspective, it used to be viewed that social determinants of health were going to make the most impact in the Medicaid population because you have a low-income community. However...
Did you say Medicaid or Medicare?
Medicaid. Yes,
it.
access.
Right.
And now the shift is changing. In the last year, we're starting to hear that even CMS is putting a lot of focus in the Medicare population. Why? Because socialization is very important in the elderly community. Not only that, because as you age and perhaps you retire, your income level is going to decrease. And we also know, David, that it only takes one episode of a chronic condition that lands you in the hospital in healthcare bills is one of the biggest factors why people go into bankruptcy, right? And so we know that people that perhaps did not have any challenge, right, monetarily, if they have an event that lands them in the hospital that leads to a hospitalization, they themselves can find themselves in difficult situations.
Just before we end this segment, are you saying that if I got a good job or won the lottery and moved to Fountain Hills, for example, would that automatically become a factor of a better or a healthier environment that perhaps would improve my health?
Short answer, yes. Wow. Short answer, yes. Depends on what you think about Fountain Hills, I guess.
Well, that's the first name that came to my mind. Monica, we have about a minute, and just if you can start, and then we'll continue on the last segment. Numbers of Hispanics, and I mean, I'm sure that the Datos has lots of numbers. Can you kind of relate again these numbers in the context of what we're talking about? What's the importance?
Sure. Right now, we know that we are on track to become a minority-majority market, which is a paradox of terms, right? We will be the majority very soon in the next couple of decades. Hispanics are 30% of the state, 40% of Phoenix Metro, and 50% of our K through 12 system.
Amazing.
And so Hispanics stand not only to drive a lot of the change in this, but also to benefit from the impact of it as well.
Right. Perfect. We'll continue on the last segment. Stay with us. We're going to take our last break. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. This is a platform that educates, celebrates, and connects the community. And I hope that we are doing just that through these educational programs. We also have very fun events, such as we call them Lunch and Learns. Follow our page at AARP, Arizona Hispanic Connection, and you'll get the information there. Before we end the show, I would like to come back to Monica Villalobos with the Arizona Hispanic Chamber of Commerce And you mentioned off the air, Monica, a West Group research study that was done actually to grade your community in the context of these elements. Would you mind sharing with us
Sure.
on that?
Once we adopted the framework of the elements of a healthy community, we wanted to test it. We're very research heavy, and we love primary research because we get to ask the questions. And what we did is we went into field and surveyed about 1,000 people in Arizona in July and August, and asked them about these different elements and asked them to rate their own communities. The median rating was 6.9 on a scale from 1 to 10. However, there was an inverse relationship between the way how well citizens rated their community in connection to their median household.
Okay.
So, for instance, in Scottsdale, much higher ratings for healthy community because there are much more of these things available. The one common denominator, though, was that in all communities, whether you were talking about Scottsdale or Phoenix or Tucson, social justice was at the bottom of all 12.
Interesting.
Meaning those areas where there is, historical and as it's described in the wheel, historical trauma and structural racism, those kinds of things are still very deep scars in our communities.
Interesting. Thank you so much. And Annabelle, you also said that there was that the U Equality Health did another kind of research as well called LEK. Is that what you call it? What? Yeah,
So one of the things we do, David, is when we go into a new area, we always commission LEK, which is a very renowned agency from California who does these profound studies. We did a granular assessment of our community. We wanted to identify population trends, shifts in population. We wanted to know where access to care is, right? Where are the providers, the hospitals, the behavioral health agencies, the community services. But then we also wanted to track some other things, such as we wanted to know where was the fast food places, where were the pawn shops, where were the liquor stores, where were the small lending places, right? Why? Because they paint you a different story of the community. We also assess chronicity of disease, eligibility for insurance, etc., and many other points. What we found, though, David, is that when you look at structural neighborhood breakdown, it's particularly in the areas where you see minority ethnic populations.
I see legislators being a key component of this conversation when it comes to who they allow to go where to establish what type of businesses.
Exactly.
That it might not be in the best interest of that community.
Exactly. Green communities or greening your neighborhoods is now becoming a key indicator of health, and yet where do you find the most green, right? The most greenery where children can play in high affluent areas in Maricopa County. And so it's the pawn shops, the liquor stores, the fast food was particularly elucidating for us because it tells you what are we normalizing to our communities, right? Particularly you and I that are Latinos and Monica that are Latinos. It normalizes those things. And in the end, everything is impacting our health.
Right. And John, I mean, you basically, I have to believe that you breathe and dream of these elements because you work for Vitalists. I'm sure that they are very clear to you and you deal with them. Can you tell us maybe one, two, any elements of this 12 elements that and the impact, just so we can understand the connection between them?
Sure. So
how they work.
A couple of things, though. I want to talk about the zip code thing one more time.
Okay.
Where do we want to go with this? Where should we be going with this? Kansas City does, actually, Equality Health does this, to be honest, but Kansas City does this with electeds. In Kansas City, there are actually 6 priority zip codes in Kansas City that the city council is working on and intentionally putting resources into to try to address this. Like they finally have said, okay, we get it. We get it. There's a disinvested zip code here. We're going to focus on it. That's what we need to do. That's where we need to get. It shouldn't just be Equality Health. It shouldn't just be Vitalists. It shouldn't just be the chamber. It's got to be everybody working on this. So I apologize if I didn't really answer your first question. Your question is a great one, though. And let me just give you some really sort of earth-shattering examples, in my opinion. 1996, Chicago, heat wave, 3 days. 700 people died. 700. Not as hot as Arizona, I get it, but 700 people died. Centers for Disease Control, U.S. Centers for Disease Control, went in and studied all 700 deaths. They found one thing in common among all 700. Most people think, oh, lack of air conditioning, something like that.
Right.
They were all alone. They were all alone. Nobody from the family to think about them. Nobody living on the same hall as them. The doorman didn't know who they were. Social cohesion is life and death, people.
There it is, one of the
It's
elements,
life
social
and death.
and cultural cohesion.
Right?
Right.
In healthcare and in public health, we talk about disparities between races in terms of health outcomes all the time.
Right.
All the time. Right? So CDC actually recently came out with a study that showed that amongst the 65 to 74 cohort, the outcomes between African Americans and whites, the gap had finally closed. CDC went back and looked at all the data and came to this conclusion. It's the only age cohort among African Americans where they actually felt the actual effects of civil rights. And because of civil rights, they got more educational opportunity, more economic opportunity, more social cohesion, and all those things added up to closing a 20-year life expectancy gap. Right?
Amazing.
So all these things actually have a real effect on life, longevity, quality of life, healthcare outcomes. I mean, the list goes on and on and on. If you just think about it for a second, right? And you think about a young woman who's in fourth grade and is having trouble reading, what does that add up to? The statistics actually say that whether or not she learns to be proficient in reading at that point in her life could add upwards of 20 years to her life.
Wow. Amazing.
20 years, because what does it get her? It gets her everything. It gets her economic opportunity. It gets her better social standing. It gets her, a different place to live, right? All these things just they add up.
Right.
Does that make sense?
Yes. And I basically walk to the park where I do my walking.
Right.
And I can imagine if I had to drive, maybe I would be hesitant to do my walk. So
That's
if
right.
you don't have parks and there's no light and this and the other, then that becomes a deterrent of people being motivated to exercise, for example.
Now, here's another funny thing. So talk about built environment and community design. What is the least obese major metropolitan area in the United States?
You know it?
New York City. Because New York City residents walk all the time.
Wow.
They walk
Amazing.
all the time as part of their daily life, right? Because it's, frankly,
Yeah.
it stinks to drive a car in New York City.
But you
Go
go
ahead.
to New York City and you don't see a lot of seniors and you don't see a lot of children. At least not while you're walking downtown.
So what does that mean?
Well, it's just that a certain lifestyle, right?
Okay.
A certain perhaps environmental design or infrastructure or city design is more apt for some populations or for some age ranges, right, than others.
Let's conclude. How does this, or what does this imply to community members in a practical way? I know that community members, for the most part, are busy working, and sometimes it's very difficult to ask them to be more active. Do you think there is a component that the community or a part that the community plays, the community at large,
Yes.
in all this effort to move into a more holistic approach to health?
Yes. The community needs to see what it is that they do and do not have.
Okay.
And then needs to ask for that they want. And it's just a matter of once you see it, you can't unsee it. Once you see that a traffic intersection in your neighborhood is actually quite dangerous for pedestrians, you need to be vocal about that. Once you see that you don't have access to parks or healthy foods, you need to be vocal about that. You need to start to look at and formulate solutions in conjunction with other stakeholders.
So once a person sees these 12 elements of a healthy community, they're going to start realizing, wait, it's not all my fault. They're going to see a bigger picture. And then they're going to start perhaps forming groups maybe in the community and start to talk about it, et cetera, Monica?
It's less about fault and blame, I think, and more about accountability. You know, when what this is meant to do is empower people to do something about it. And this allows us, for instance, with the Hispanic Chamber, when somebody comes in and says, what business should I start? What business area should I be in? I can say, here are 12 opportunity areas where we need more services, where we need better access. And so it's meant to be more empowering and to give people tools to be able to change their own destiny and their own fate, and not just simply say, well, this is where I grew up, this is where I was born, this is where I grew up, and this is where I'm going to die, and I'm going to die, 14 years earlier than somebody in, another neighborhood 10 minutes away.
Right. So I really see that this is so critical, even at the community level, so that even if you cannot do too much, number one, you can become aware. You can start seeing these elements in your community, and then that should lead us to start advocating. Yes. Perhaps talk about in the community groups, neighborhood groups, and then start to talk to your mayor, to representative, and so on. Is this the right approach from the community level?
I think so, David. I think advocacy, right, and then start moving policy so that we can affect policy is a great change, right, or a great thing. I like to commend Vitalist and John's effort, right, because they're the conveners. They're seen as the convener right now in the community, and the community is mobilizing. I think John is doing a great a job at bringing the healthcare entities together, right, and even community-based organizations and everyone to start the discussion. I mean, to the extent that the Hispanic Chamber is now collaborating in this effort. So I think there's great forces changing, David, but it starts not only with conveners like Vitalist and organizations like Equality Health and the Arizona Hispanic Chamber of Commerce, right, but also the people. Right. Elevate and empower people so that they can start advocating for themselves and their communities.
Right. We have run out of time. Thank you, Monica. Thank you, John. Thank you, Annabelle. This was an amazing discussion, just the beginning, because these 12 elements of a healthy community, we will continue to address them. Stay tuned. This was AARP Arizona Hispanic Connection. Have a great day.